So here we are. We're 10 days out. 10 days out from surgery, and we're taking the initial surgical cast off. Now this procedure was a little bit different than the last one because it was complicated by adding in a little bit of carpal tunnel release.
It's just a little incision right here, and then at the carpal tunnel area.
Okay.
So it's pretty. They're pretty minimal, both of them.
Yeah, he said it was only about a 5.
Just IP motion for 2 weeks, and then we'll start doing our position, and then we'll get rid of that.
Yeah. I really, I mean, the massage was great. That heat unit outside was really great. So, and then I used a heating pad at home, and then just did a lot of this when I was in the heating pad. So,
Perfect. You look great. Proud
No
of you,
complaints.
Man. Proud of you, buddy.
Okay.
Round 2. You gotta grow another thumb for me.
Next will be knees or something else, right? Thank you so much.
Thank you.
Thanks, Elizabeth.
You're welcome. So we're gonna clean it up
okay.
a little and.
They're getting me set right now for the temporary cast. This is a form-fitted piece of plastic that will designed to keep the thumb immobile, and it'll be held in place with Velcro strips.
For now.
Yep.
Yeah.
Okay.
Really
He'll yell at you.
can't, and I shouldn't,
Right.
move it much more than this.
You shouldn't be doing that.
Yeah.
shouldn't even
It's
be
only
doing
the tip. Nope. You shouldn't move this joint at all. Only
There
the
we go.
tip.
Now
So
I'm getting really.
So you have to. So if you're gonna move it for the camera, I would just hold it here with your other hand.
Ah,
Block it there,
I see it.
and
And
just
then,
move the tip. Yep.
Okay.
That's all you're allowed to
and that
do.
actually hurts, so I don't want you to do that.
I told you you'd get in trouble.
Maybe I made it stay down better.
Yeah, that's good.
And you can put it on tighter if you need it, or looser.
Yeah.
Does that feel pretty comfortable?
Yep, that's.
Yeah. You have quite a bit of. Yep. And you can have good movement in the tip of your thumb.
Yeah.
So practice doing that. You know, moving that tip. So you can move that tip as much as you want.
Okay. Yeah, thumb is almost totally rigid. I can, if I did this, I can feel it back here a little bit, but just don't do that.
Yeah. Yeah.
Yeah. Okay. Well, that was 2 days ago. Now I'm just getting used to the little half splint, and that seems to be working out quite well. I do have to go back to the occupational therapist in a couple of days and begin that level of treatment. Right now, it's going to be very, very minor. There's going to be no use of the thumb. In fact, the final words of the doctor to me was, forget that you even have a thumb for the next probably 4 weeks, 5 weeks. And while there is a little bit of movement in there, this is all the movement that they want. I've got full movement of my fingers up here and just minor movement of this. I do need to get one adjustment made on the plaster, not on the plaster, but on this plastic splint. I'm gonna take off the Velcro. There is an issue right up here with the thumb, right around here, where the therapist needs to go back and make it a little bit wider because it's just too tight fitting, and to get the thumb out, it's a bit of a tough thing. But as you can see, I'm wearing the compression sock that they gave me, and I just cannot move that joint right here. Shouldn't move it, but I got full use of the fingers, which is really good, and I practice this. I practice with this every day. Now I'm a drummer and I'm a guitar player, and having gotten this hand fixed, this is my important hand because it was, even though this is my dominant one, this hand is the one that I used to go ahead and form all my chords when playing guitar, and it was very, very important that I get this thing fixed first. Now that I'm on my dominant hand, my big issue here is when I'm playing guitar is the use of a pick. And I can't do that right now. And I'm probably not going to be able to do that for at least, maybe 6 weeks or so. Because I've got no range of motion in there. And that's just gonna take a little bit of time. But overall, it was extremely fine. The level of discomfort was minimal. The funny thing was, when they gave me the nerve block in my arm, everything from the elbow to the hand was completely dead. I could see it, I couldn't feel anything. It was a very, very bizarre experience. But from the elbow up to my shoulder, I had full motion, full capability. So I could raise my arm and do this. Well, you know how you sit back and occasionally you have that little urge to scratch something. You know, you come up here, scratch your nose, and that's it. Well, what I would do is I would use my dominant hand, come back up and try to scratch my nose, but instead I would raise my hand up, and since this hand had no muscular control, I wound up taking my hand and beating myself in the nose a couple of times. Not funny. Yeah, it really was pretty funny, but quite embarrassing. So my instructions going forward is very simple. Don't use the thumb. Like the doctor says, pretend it's not even there. Wear your splint as much as you can, virtually all the time. The only negative issue I'm having dealing with this plastic splint is trying to work at the computer. It's very, very difficult to go ahead and use my mouse with my dominant hand because of this portion of the splint. I can't get my hand wrapped around the mouse. But the good news is, when I use the mouse like this, and my hand is on it like this, note where my thumb is. My thumb is off to the side, virtually immobile. All I need to be able to do is use these fingers here and be able to move around. And that pretty much eliminates the use of my thumb. As soon as I'm finished with the mouse, and I'm ready to wrap things up on the computer, I'll go ahead and slip this bad boy back on, get him all velcroed up, and get this guy around. I'm good to go. So stay tuned for further updates. I'm not anticipating anything abnormal out of this. I suspect that here we are at the early part of February. It's been 12 days since I've had the surgery. I would suspect that I'm going to be back gigging again, playing drums and guitar, probably in the next 6 to 8 weeks. That's about what the time frame it took me to go ahead and get my left hand back in working order. So that's about it. I'm happy as hell right now, and things are going great. Kudos to you, Dr. Sforzo, for helping me out. So that's it. Andy Browne, I'm out of here, and we'll chat with you later.